oh my gosh, I'm getting married.
You're already married.
No, not me. But that's what people say when they come in sometimes. We do wedding consultations, and I love them. It's one of my favorite things to do at the office. But it is really important for brides to know what the timing of everything should be for their weddings. So, everybody, you're going to do a trial for your hair. You're going to do a trial for your makeup. You have to do a trial for everything that you want to do for your skin, too. Ideally, I would love to see a bride at least a year prior to their wedding. Now, it depends on what your goals are, but some things we do, there are some laser treatments and collagen stimulation treatments that are going to take 6, 9, 12 months to really see the full result. It's not to say that we can't do consultation and wedding planning 6 months, 3 months, even I've had brides come in 1 month before their wedding, and there is always something that you can do, but if you want to kind of be ahead of the game, a year, even 18 months is ideal because it gives you time to test run these things and make sure you love it, your skin loves it, and it's really important.
And how do you approach it if someone either, like, for instance, someone says to you, getting married, I've never done any medical treatments or spa stuff on my skin.
Yeah.
How do you approach that?
Well, first of all, we need to figure out what your goals are. A lot of people kind of want to try things for the first time when they're getting married because they're like, you know what? This is about me and this is, my time. I'm going to be heavily photographed at my wedding. So I really want to try Botox for the first time or something that's like always been bothering me that I never really gave myself permission to address is now they're finally giving themselves permission to. I have a calendar on my consultation sheet that I specifically map out what needs to be done. You want to do injectables, you want to do Botox at least 1 month prior to an event. You want to do your hydrofacials at least 1 week prior. If we're considering laser treatments, so addressing like redness or pigmentation, those are things that we can't really do for the most part in the summertime. Yeah. So you have to factor that in, like when is the wedding? If you have a spring wedding, then it's fine. We can treat these in the winter. If you have a September wedding, then we need to look at how we are structuring this so that we're not trying to do laser treatments in the summer right before the wedding. So we map that all out month by month.
Everyone has a time and budget, right? So but that allows them and me to know, okay, these are the things you want to accomplish, and unfortunately filler is very expensive jelly, so it allows them to prioritize, and I think that's really key.
I think that's key too, and I'm glad you brought up filler because filler is very long lasting. So if you are considering filler for your wedding, that's something that you want to be able to try and live with for several months. Yeah. That's not something that we want to do 2 months out for the first time before the wedding. No. That's why I love people to kind of plan a year to 18 months. And it also, brides have so much like, okay, I'm getting married. Now I have to do this and venues and flowers and all of this stuff. And so many of them have told me over the years, like, okay, and this is so great that like someone just told me what I need to do and when, like, because they don't know when am I supposed to start these things? When am I supposed to do it before the wedding? So we can take the pressure off that one little aspect of wedding planning, and it's a big relief.
Well, diving into some of the specifics, let's talk about your approach to any of these one areas with a bride and time frame in mind.
If a bride would like to try Botox for the first time, let's say, for example, they've never done it before, for our average patient, Botox lasts about 4 months. That's when it's really starting to kind of wear off. I'm at the 4-month mark right now. Everybody can see that. So I'm getting ready to retreat in about a week. But this is when you're really starting to see a lot of movement back. So you want to have the space and time to be able to try the Botox, live with it for those 4 months, and then do your wedding treatment 1 month in advance of the event. Because Botox will take about 10 days to 2 weeks for it to really fully set in. And then if we need to do a little touch up, sometimes, we need a little bit more here, we need to even something out, then you can do that touch up, and then you have that other 2 weeks so that you're wedding perfect, and it's that month out for the Botox.
Well, I can tell you also from my injector perspective, the reason I love the long time frame is I'm learning your face.
Right.
So if I have
Getting the recipe.
3-4 month trials,
Yeah.
you want to make it a little this way, and it's a beautiful thing to have that time frame.
For sure, everyone's getting their recipe and what they like, and everybody's different. Giving yourself the time to kind of play with what you really like and what you really want.
When it comes to laser stuff,
Yes.
there's different kinds of lasers. Do you approach it differently for a bride than someone else?
Not necessarily for a bride than someone else, unless it's a timing issue for the wedding. But I mean, there's all kinds of considerations for lasers. There's time. So if we're talking about laser hair removal, that is 6 treatments done over 6, 8, sometimes 10 months. So that is a long process for people. If we're doing a laser that targets pigment, so melasma, brown spots, sun damage, things like that, those treatments cannot be done if people are getting active sun exposure. So for most patients, summertime is pretty hard to do those treatments because most people are just not going to go live in a closet for all 3 months. They're going to be out, they're going to be hiking, they're going to be working in their garden, and your risk of side effects will go up if you are treating on tanned skin, on anything that's had active sun. So those are always considerations, brides or no, that we would take for lasers.
Brides come in all different ages, right? But if they're on the younger side, they may not need such an aggressive laser.
Sure.
And also, I mean, a lot of brides are just so busy with all the stuff they're doing. And so having that as a minimal downtime, yet giving them that fresh look. I mean, what is that something you lean into, the Moxie for brides?
Oh yeah, Moxie is great. Moxie is a resurfacing laser. And so sometimes when I say resurfacing laser, people are like, okay, that sounds really serious. But resurfacing lasers can run the gamut of like very, very light, very superficial. They can be very, very aggressive, like you're a burn victim for weeks. It can be kind of right in the middle. So Moxie is that very light, very superficial. It's really good at getting like the diffuse pigment. So kind of background dyspigmentation, and it's great for melasma. It's great for all skin types. Some, especially my darker skin tone patients, you have to be really careful about lasers because they're not appropriate for all skin types, but the Moxie is. The Moxie does have a little bit, you get kind of dark and speckly for a couple of days, so I do have to warn brides sometimes. You also have all these considerations as a bride, like your engagement photos and your bridal shower and your, bachelorette party and all of this stuff. So, any downtime, that's why that calendar is so helpful when you have a year out of like, okay, I know my bridal shower is 2 months before the wedding and, my bachelorette party is this, and we can sort of structure things around to make sure you're not speckly or red.
Okay, it's within a month you can get a hydrofacial and that's it. But what about the other things they can do in that room before that?
I mean, it's kind of endless. There's chemical peels, there's microneedling. I mean, microneedling is one of those, which we love. It's really, really popular. Patients love it, but that's for collagen stimulation. So you're gonna need that 4 to 6 months to really, really see a strong improvement. So if a patient is coming to me with acne scars or some set-in fine lines or like enlarged pores or something like that, that's something that we need a little more time. Everybody comes in and they're like, I saw this on TikTok and what am I supposed to be doing? And I don't know So I do like to kind of hone in on the 4 cornerstones of skincare that people should be doing. Sunscreen is number one.
Always.
Everyone should be using an antioxidant in the morning. So that will neutralize free radicals in the environment, which helps with environmental damage. So sunscreen, antioxidant, exfoliator, because that's promoting cellular turnover. So you're going to look nice and fresh and glowy. That's particularly important for brides because you want your makeup to go on smooth. You want to look nice and fresh. So continuing to kind of promote that cellular turnover is great. And then retinols, depending on the proximity to the wedding, I wouldn't necessarily start brides on retinols if they've never been on it, if we're close to the wedding, because sometimes there can be like an anticipated reaction. An anticipated reaction is you might get red, you might get peely until your skin kind of adjusts to being on the retinol. So not necessarily something that I would recommend starting if we're close to the wedding.
And you talk about the whole makeup issue. I have noticed, is the dermaplane relatively close to the wedding or closer because of the makeup issue?
Dermaplane is great. So
Why?
is a surgical blade that they use to remove the vellus hair, so the little peach fuzz, and it also exfoliates. So we have the makeup artists that we work with in town recommend their brides to come in and get dermaplaning about a week prior to the wedding.
Okay.
But if you are a patient that tends to break out,
Yeah.
sometimes dermaplaning can kind of open those channels and kind of stimulate a little bump in breakouts. So that's another thing that I wouldn't necessarily try if you're not accustomed to it, or you haven't sort of test run it on your skin and see if your skin likes it or not.
When our patients get attached to an esthetician or an injector, they want to stay with them.
Sure.
And people get booked up. So the beauty of figuring out what you want, and then just, I've heard you say, just book it. It's 9 months out, just book it.
That's a really good point.
We start with the wedding and move backwards from there, right?
Yeah, I tell people as soon as you know your schedule, get your stuff on the books. Even a year, our books are open a year out. You want to make sure that you have that Botox a month out, the hydrofacial the week before, your lasers in the wintertime. Like, it's the sooner you can book everything out, the better.